A very good morning for the Americas, good afternoon for Africa and Europe, and good afternoon or even good evening for Asia and the Pacific. My name is Marcelo Caetano, and I am the Secretary General of the International Social Security Association. So we are continuing the series of webinars today. We have about once a webinar per week. This week, more particularly, we have twice. We have two webinars. And concretely speaking, today we will be discussing about subsidized social security contributions to bridge the poverty gap. This webinar is a webinar that is promoted together by ISSA and the International Labour Organization, ISSA and the ILO. And so for this reason, we are having two moderators for this webinar. So from ISSA side, we have Shay McCallum, who works with us, a senior officer in Social Security in ISSA. And from ILO, we have Chantal Siricena, who is Social Protection Officer of the ILO Regional Office for Arab States. So before introducing the panelists, let me talk a little bit more of this webinar because it has some particularities that is quite interesting for me to present to you. So this webinar, it's totally linked to a study that was done by ISSA and the ILO over last year and this year. And the purpose of this study was to build global knowledge around schemes to subsidize the social security contributions of workers and employers. So this report that was published today at our website, along with the ILO. So you see the two logos at this report if you enter at our website. So this report, it received a lot of contributions for our membership, from ISSA members. We produced a survey, we got the response, follow-up, where the follow-up were also vital to building this knowledge base. And of course, we thank everybody from the ILO, from the ISSA membership that contribute to this webinar. So this topic, it's the original idea of this topic, it appeared, it was originated in the Arab region. So with one of our members, that is the Social Security Corporate of Jordan. And of course, as we mentioned, it's a totally joint work with the ILO, and in this case, more concretely, with ILO Jordan and the Regional Office for Arab States. But of course, that when we are talking about this matter, it's not just an Arab issue, it's a very global and international topic when we are talking about the subsidized contribution. So it gave one step forward, and the topic is really of global relevance. So for this reason, we see that the webinar is also an opportunity to reinitiate, to restart the webinar series that we have been conducting jointly with the ILO Regional Office for Arab States since more or less the middle of last year. But also with the support from the socialprotection.org. So we are pleased to be able to host this new episode on our ISSA platform and encourage all of our members to consult other webinars that we have done in this series if they are interested, also others that in the future may come. So thank you very much for ILO, Jordan and the Regional Office for Arab States for this cooperation, and ILO as a role. And although, as I mentioned, this began in the Arab States, it's quite a global perspective. So, but that is really an international and global perspective. You will see that our panelists are super global in that way. So we have from the International Labour Organization, Fernando Martinez Curi. Fernando, who is project manager and also a social protection specialist at the International Labour Organization. Another expert that we have, Bettina Ramirez Lopes, who is an independent expert, and she's from Norway. Also from the academic world, we have Oscar Cetrangolo, Oscar, who is professor of public finance of the University of Buenos Aires, Argentina. So we see very spread all over the world. Also from Latin America, but then we are coming to our membership. We have Eduardo Alcaraz Pros, who is head of Social Security Registration Unit of the Registration and Collection Directorate of the Mexican Social Security Institute in Mexico, one super active member in ISSA. And we have also other 3 super active members in ISSA that are present today. So we have Nur Anu Izzat Abdullah Suhaim, who works for the Social Security Organization in Malaysia. Also from Malaysia with us, a person who is very engaged in ISSA. I see her from time to time. So Balkais Yusuf, who is head of Policy and Strategy Department of the Employees Provident Fund in Malaysia. And last but not the least, our friend from Jordan, Mohamed Krais, who is head of Department of Research and Actuarial Studies Administration of the Social Security Corporation in Jordan. So as usual, these webinars, they attract a very interesting, good amount of registration from all over the world. So the last time that I saw the registrations, we had for today 55 different countries. So before giving the floor to Shay, I'd like to remind everybody the major event of ISSA that it happens only once in every 3 years. That is the World Social Security Forum. The World Social Security Forum that will be from the 29th of September to the 3rd of October this year in Kuala Lumpur, Malaysia. We have 2 panelists from Malaysia to be in their city, Kuala Lumpur. It's really a very good opportunity for you to be there, to share knowledge, to network, see what other people are doing. So we have a very good number of registrations now. For the moment, although it's a little bit more than 3 months to the beginning of this event, we have more than 400 people who have registered in many different countries and organizations. So the number are quite good. So we'll probably break all the records of registrations for the World Social Security Forum. So we have to see. So it's really a good and unique opportunity that happens only once in every 3 years. So before closing myself, I wish all of you an excellent webinar. Unfortunately, I have to leave quite soon. So I say my goodbye now, and I give the floor to Shay. Shay, please, the floor is yours.
Thank you, Marcelo. And I just want to echo Marcelo's warm welcome to all of you from all of the diverse communities of practice that he described that this webinar reaches, linked to ISSA, linked to ILO, and beyond. So thank you for joining us from wherever you are. I'm going to be one of your moderators today, having coordinated the ISSA's contribution to this project. But as Marcelo noted, I'll be sharing this role with Chantal Sirisena, who will introduce herself shortly, and she coordinated the ILO's portion. And I'll take you through the first half of the agenda. Just before I hand over to Fernando, I wanted to remind you of some housekeeping. It's popped up probably in a bubble, but please note that you have interpretation in English, Spanish, French, and Arabic. So please click on the button at the bottom, interpretation, and choose the language that you want to listen to the webinar in. There's also a Q&A button, and that's where if you have questions throughout the webinar, please put them in the Q&A box, and we will sort them and deal with them toward the latter part of the webinar. The chat is for us to communicate with you, so please don't put your questions there. So with that, we really appreciate the opportunity to share this space with all of the actors gathered here, and in particular with ILO Jordan. So I'm going to hand over now to Fernando Martinez Cude from ILO Jordan to offer some brief opening remarks on behalf of the ILO team. Fernando, over to you.
Thank you, Shay. Thank you, Marcelo, and thank you, everyone. Welcome, everyone, again. I promise I'll be super short, and we'll get to the action as soon as possible. I just want to welcome to the first episode of the second series of the Arab Social Protection Compass, an initiative by ILO in the Arab states, ISSA, and socialprotection.org. This platform was created to spotlight reforms and programs on integrated social protection and to inspire national and regional level discussions. So, right, the idea is to spark and have a place in where practitioners can come together, discuss, and then see what elements of those discussions can be then started to be integrated within our own countries. We believe that achieving universal social protection, of course, requires gradually integrating contributory and non-contributory schemes. So that way we can move from fragmented systems that leave many vulnerable groups behind, as we know. Across the Arab states, there's a great wealth of experiences and fantastic examples of things that we can highlight so we can learn from one another. And this series is responding to the demand from learning and exchange on how to drive those integrated reforms, learning from one another. This year, in this year's series, this is the second series, we're going to put more emphasis on operational challenges, connecting national experts with international specialists, and provide practical guidance for those leading reforms on the ground, such as this example that we're going to see today. Please follow us in the ILO, ISSA, and socialprotection.org for news and upcoming webinars in the series, or reach any of us will have the info. I just want to highlight our collaboration with ISSA and thank you for this partnership, which allows us to conduct this first global review of contribution subsidy mechanisms. Super interesting. You'll get to see it now in a second. This report that we're presenting today, it covers 41 programs for 26 countries. So it's an important foundation to start building a compendium on contribution subsidies. We hope these resources will help many of you in designing and refining your own contribution subsidies. Thanks a lot. And with that, I'll hand over to Shay again. Thanks, Shay.
Thanks, Fernando. As Fernando mentioned, this has been such a close collaboration between ISSA and ILO from the outset, from the design and implementation of the survey to then developing the scheme descriptions. So I'm sorry I'm going to abuse my role again, but because they won't have a chance to show their face today on this panel, I just want to recognize all of the ISSA sides of the contributions that came together to make this happen. And first and foremost, of course, as Marcelo mentioned, the ISSA members themselves, who are the primary source of this knowledge. So we want to thank you. You are the basis for these scheme descriptions. We know, as Fernando mentioned, that there are 41 descriptions in 26 countries, but this is not the full universe by far. We believe it's a great first start at mapping the landscape. We have 3 experiences here today that you'll hear from. But it's just the beginning. So second, I want to acknowledge that these scheme descriptions are only digestible thanks to the hard work of Madeline Cretney, who's online. She developed them with us based on analysis of the survey responses and close exchange with all of you ISSA members over many, many months. So we hope that you'll consult them and let us know if you're not featured yet and you want to share your experience. And also Elena Nieri, who helped us finalize these. I'm not sure if she's online yet. So with that, I'm pleased to hand over the floor to Chantal Sidusena, who's my co-moderator, but also the coordinator of the ILO's technical team on this project. Chantal, over to you.
Thank you very much, Shay. And first and foremost, thank you to ISSA for hosting us in this joint ILO and ISSA space for this important conversation on contribution subsidies. And thank you very much to the ISSA members who are joining us today, as well as the other participants from around the world. So my name is Chantal Sidusena. I am part of the social protection technical team in Jordan, in Amman, Jordan, where the core part of our technical collaboration is with Jordan's Social Security Corporation on Astadama++. And Astadama++ is a contribution subsidy mechanism, and we're delighted to have Mr. Mohammed Kharis from Jordan's SSC to tell us more about that in the roundtable segment of this webinar. Now, in terms of in 2022, that was really the inception and the design phase for Astadama++, and it was during that design phase that we had the genesis for this idea around the research, taking a broader perspective, taking a global perspective, unfilling what we saw to be a gap in the literature, particularly around answering a number of the questions that arose for us as we went through the design phase of this subsidy. Now, of course, in our own process, we had a very data-driven approach. We published in 2021 a study that looked at the coverage gaps in Jordan, drawing on labour market survey panel data. We were able to identify and provide a snapshot for our work on where we had the highest rates of informality, in which sectors, which worker types, amongst which types of contracts, and even amongst nationalities and gender splits as well. So that gave us a really good idea in terms of targeting. And of course, in that report, we also looked at the various barriers to extension of coverage, and one of which is often the legal barrier. But again, in Jordan, a specific context, those legal barriers are not very significant. So in that snapshot a few years ago, it was less than a quarter of workers in the informal economy that were facing de jure barriers in terms of de jure coverage. That's rapidly decreasing with further legal amendments that ISSA and the Jordanian government are pushing through. So we know that the majority of those in the informal economy are facing other challenges that are causing non-compliance. And through additional quantitative and qualitative research, we know that one of those major barriers is the affordability barrier, the financial constraint. And one of the tools, one of the important tools that we will discuss in a lot of detail today is a contribution subsidy, so a mechanism that will reduce the amount that you're paying for your contribution, but importantly, maintaining the benefits that you receive. So improving the overall accessibility to the system. There are other tools that Social Security institutions can use, and this is something that Bettina will go over for us in her segment of the presentation shortly. But of course, in the design process in Jordan, so we have a very clear idea of the policy objective in terms of closing coverage gaps. There were others as well, and Mohammed will speak to that, I'm sure, in his roundtable presentation. We had a very clear idea in terms of the targeting from this data-driven approach, but there were other questions coming up in terms of the subsidy design. So what is the value that needs to be transferred to meaningfully reduce this financial barrier? How long should the subsidy be in place? Can it be time bound in order to have a significant impact and retain the density of contribution subsidy subsequent to the subsidy ending? And other questions like this. So this is where another piece. So there are two forthcoming reports that were ILO-led. I mean, a very joint collaboration with ISSA, but the ISSA-led survey then informs these other reports coming forward. So first on situating contribution subsidies within the broader literature and within the broader menu of policy options open to Social Security institutions as they try and address this financial barrier, but also a second study that was led by Oscar Sotrangelo and Ariella Goldsmith. And just to introduce Ariella, sorry, I think we missed you in the opening introductions, but Ariella is also based in Buenos Aires at the university and is a colleague of Oscar and a key researcher on this project as well. And that separate report is a more practitioner-focused guide that goes through in sort of a modular framework of every sort of step along the way of designing a contribution subsidy, looking at doing a few deep dive case studies into, I think it's 7 cases, and again, giving that insight into sort of which context apply to which maybe policy objectives or design approaches. So with that, let me stop here, and I will hand over first to Bettina.
Thank you, Chantal, and thank you everyone else for your time as well. So like Fernando said, we go into the action now. It was because the other researchers were doing a deep dive into country cases, it was my task rather to take the big bird's eye view and see what kind of big lessons we could, what kind of patterns we could extract from this selected sample of countries in terms of how subsidies are actually being utilized and implemented around the world. So hopefully we have some interesting insights on that for you, including an emergent typology of the different kinds of subsidies that there are, because we found many different countries conceptualize subsidies in different ways, and that is a major barrier for a productive discussion, not only between countries, but even within institutions and different actors in a country, as to what we refer to when we talk about a subsidy and which one is more appropriate for different policy objectives that one might have, depending on which part of the government we're coming from. So to begin with, well, the first question is why subsidies matter, right? Why are we in this space? And some of the other speakers have already referred to that. But I think everyone from your background in this field know that a consistent challenge around the world for expanding participation in systems or maintaining participation is affordability, particularly when labor markets have a lot of irregular or low-earning workers in the informal economy or non-standard types of work, particularly now that they're expanding with the gig economy. Even very modest contribution amounts or contribution rates can be really unaffordable if they are due every month and in full as well. So, but still in many systems, you know, from the sample and the ones that we have here, Malaysia, Brunei, the Philippines, even Jordan itself, self-employed workers in particular have to cover both the employer and the employee share of those contributions, making contributions to Social Security a fixed cost with no counterpart to really help share that burden, and putting them in a very different situation that standard employees, wage workers. Beyond that as well, people with fragmented work histories, especially women, people who step away from the labor market for care reasons, or people that are juggling in between the formal and the informal labor market, in between self-employment and dependent work. The very structure of social insurance, which comes from a different time, you know, than the one that we are in now, it makes it very difficult to even meet the qualifying thresholds, the vesting periods for receiving adequate benefits. And so subsidies come in as one of the tools that countries have to address this issue of affordability, but it's not the only tool that we have. It's important that we understand subsidies in the context of the other policy tools that governments have, because as you will hopefully get, not just from this presentation, but once the reports are released, one of the main things that we found is that subsidies alone are really not enough to fulfill the policy goals that they're being implemented for. So we have first three broad types of instruments being used with the idea of addressing affordability to participate in the system. The first one is price-based tools, which includes all these financial subsidies and many different types of financial subsidies, which is what I will address in the next few slides. We have also design-based policy tools that are more about adapting this very binary system of social insurance to non-standard types of work by making contribution schedules more flexible, contribution rates also more flexible, even adjusting benefit packages depending on the replacement rate, many different things like this. So usually the innovations that we try to put in to make the system more responsive to the specific circumstances of the groups of people that we're trying to expand coverage to. And then finally, there's also the perception shifting tools that policymakers can use or institutions can use that build awareness and trust in the system. And that can range from communication campaigns that simply highlight how the system works and the value of contributing to the system for those that may not know, but also just administrative reforms that make the system easier to use. That's already a big contribution in terms of the perception of the value of participation. And one very nice example that used all this menu of policies that came out from the sample was the special regime that Argentina created for domestic workers. In Spanish, it's called el régimen para trabajadores de casas particulares, I believe. And it's a very comprehensive design that uses, in terms of price-based tools, they have flat rate contribution subsidies that are coming from the government at a higher rate than other subsidies used, because this is identified as a very vulnerable population, because it's female dominated, also lacking in other types of labor rights. They also have some type of employment subsidies for the employers of domestic workers, for example, allowing them to declare this within their tax declarations. They also went through a long process of changing legislation to formally recognize domestic workers as employees with the rights of every other worker. Workers themselves can work part-time or by hours and contribute on the basis of that, making it very flexible to bringing not just their main income from their main employer, but to accumulate various different income sources, because many of these workers are no longer working in a single home, but coming from different homes that are constituting their whole income. So it's a good example that we discuss more in the report, but that you can refer to as well in the compendium to understand how price-based tools, and in particular contribution subsidies, can be used within a more comprehensive approach to incorporating vulnerable workers into the system. One of the reasons why you might not have heard about these different terms like price-based tools or perception shifting or even different types of subsidies themselves is because the literature doesn't really have a comprehensive treatment of subsidies from the point of view of social insurance or any sort of typology that incorporates them all. The literature is mostly focused on employment subsidies, which are the subsidies that are granted to employers of workers, and usually with the intention of lowering the cost of labor so that more employment can be created, or what actually ends up happening, so that informal work is formalized in the economy. This kind of subsidies come more from the active labor market tradition. So maybe 30 years ago, when this started getting popular, this kind of subsidy came up as a way to deal with the issue of formalization. But it's not the same thing as what we talk about within social insurance institutions, for example, that Chantal referred to as contribution subsidies, going directly to the worker to reduce their contribution rates. That's something that is coming from the social insurance perspective, and where there isn't really a lot of literature trying to understand what the design, what the impacts, and so on are. And then very interestingly, even though the survey instruments didn't actually ask about benefit subsidies, this third category, there was quite a few countries that reported on subsidies that are a little bit more ad hoc, so that come after the contribution has already taken place and it has not managed to secure an adequate benefit. So things like that you will recognize, like minimum pensions or supplements to benefits, short-term or long-term, or even care credits that are becoming more popular around the world. This, even though the literature has not really conceptualized as a subsidy, are being recognized in country by practitioners as such. So we decided to include it as well into this broader typology, so that countries can understand that subsidies can come in the design phase before, while people are contributing, but it can also be a post-fact redistributory tool. You have a lot of options. So the functional typology of subsidies that we present, it's very simple, and it's in a very fresh stage. Like we said, we had 26 countries with 41 schemes. So this is something that will grow as we continue with this work, hopefully. But we have three main subsidy types, financial tools. We have the worker focused contribution that is meant to lower the cost and thus enable participation. This kind of tools are mostly found in lower middle income countries, where affordability really is the chief barrier to participation. We got cases from Iran, Malaysia, Jordan, but even in Germany as well, for low income workers, this is still a tool that can be utilized. Then there's the employment subsidies that I already talked about, which are used more for incentivizing formal hiring, and that look for employment outcomes, but don't really follow whether employment equates with social insurance participation. Those come up more in upper middle income context, where informal labor still persists despite having stronger administrative systems and higher wages as well. And then finally, the benefit subsidies that I mentioned as well, which are focused on ensuring adequacy of benefits more than anything. And these are more common in high income countries that are more focused in policy in addressing adequacy and other important policy objectives like gender gaps. Finally, it was interesting to find as well that there is a growing number of countries, particularly middle income countries, that are implementing hybrid or blended type of contribution subsidies, particularly blending contribution and employment subsidies to reach multiple policy objectives at the same time. Some of these are very famous, like the monotributos in Uruguay, Argentina, Mexico. And they try to be a little bit more creative and recognize that there are challenges coming both from the supply and the demand side to be able to participate in social insurance, because it's usually a tripartite system, right? And there's a lot of variation within these hybrid models as well that is available in the compendium to understand. So what did we actually learn from the survey? A bit more in the numbers, although we have to be clear that this is a very self-selected group, and so it's not globally representative, but it still gives us some interesting insights into some trends that are visible even at this level. So we see very clear trends in the sample by income level, for example. In lower middle income countries, for example, every single scheme that was reported included a worker-focused contribution subsidy. So there's really a focus or an understanding that the main barrier is coming from the worker side, probably because wages are still very low, people still don't understand how the system works, they're not so willing to participate. So that was a key element of how subsidies were being implemented in these lower income settings. And for them, coverage expansion was really the top policy goal. That also makes sense because usually these countries have newer, not yet mature social insurance systems that are still trying to put in place all their branches, their legislation, and so on and so forth. And yet subsidies were already part of their menu of policies. Then if we move to upper middle income countries, that's really where hybrid and employment focused schemes emerged in the sample. And they often targeted micro enterprises or very specific, narrow, vulnerable groups like youth and women or people with disabilities. And in higher income countries, the majority of the reported schemes were actually these benefit subsidies, the one that we weren't looking for, but found. Even though the respondents didn't call them that, they included them in their examples. So overall, we can see that as countries evolve from lower middle income to higher middle income and then just high income status, their focus shifts from coverage expansion to formalization, and then finally adequacy. The financing mechanism, in terms of policy objectives, closing the coverage gaps for very specific groups was by far the most common policy objective for subsidies. This is really the main purpose of this tool. But as I said, with the change in the income status, the policy objective broadens to include other areas of policy as well, like formalization. It would be very interesting, for example, in terms of building the evidence, to follow up a little bit more on the impacts of this shift and whether expanding the policy objectives can be achieved effectively with the same kind of policy tool. In terms of the financing mechanism for subsidies, we found as well that they're very deeply linked to a country's formal employment rate and their GDP per capita. So across the board, most of the financing used for subsidies is explicit, meaning that it comes directly from the government's budget. There's only a few countries in the sample which use sector-specific funding, like, for example, Iran, which collects contributions from construction companies to finance the subsidies of construction workers, or more commonly, implicit cross-subsidies within the fund itself. So having formal or already wage workers subsidize non-standard workers. But that second, or that third option of implicit subsidizing was really only seen at a certain level of development in terms of the labor market and a critical mass of the membership base of the institution, because you need sufficient full paying, let's say, members or affiliates to be able to sustainably subsidize the participation of non-standard workers that are coming in with lower contribution rates. So it's not really a financing choice that is available for every country, and that is why explicit financing from the government budget continues to be the most common form of financing. And then finally, in terms of this design characteristics, we found that nearly all the schemes were targeted, and not just by a single level, but there was several layers of targeting for every scheme. So it can be from specific earnings groups, so people that earn up to this level or up to that level, occupations only for construction workers, only for agricultural workers, or employment status, like for the self-employed, or in terms of the size of firms, or more commonly, actually, the level of revenue of firms, or other types of labor market activities, like being an unpaid caregiver and so on and so on. So most schemes actually had several layers of this targeting, which made them very, very specific and focused on small groups of the population. And this is probably why as well they can be financed from budget contribution, because they're not targeting a large portion of the population. They're targeting very specific portions. So in that sense, these subsidies are not really used as a mechanism for large coverage expansion, but more for inclusion of difficult to reach groups. And then finally, the policy takeaways. So there's a lot more detail, of course, in the report, which you'll hopefully get to see soon. But the big policy takeaways that we have to share with you is that it's possible, but it's complex also, designing inclusive and sustainable subsidies. And it's something that has to be done in a very conscious, thoughtful, evidence-based way. For example, we can think about pairing price-based subsidies with flexible contribution design to really address the challenges that non-standard workers face. Because let's say agricultural workers, they not only suffer from low incomes, which makes it hard to meet the fixed cost of contributions, but also from irregular earnings, seasonal earnings, and the contribution schedules of institutions need to be able to accommodate these conditions, because it's not going to happen the other way around. The agricultural season is not going to become monthly in order to fit the schedule of social insurance institutions. Another interesting thing that came up, and unfortunately there's not a lot of evidence on the actual impact and follow-up of the the impact of subsidies is that they need to be designed not just to incentivize registration, which is the first sign up or affiliation membership to the system, but to sustain that participation over time, even after the subsidy ends, if it's a temporary subsidy, which was the case in most of this. Subsidies also need to be designed to address structural inequities, like, for example, in terms of gender, there's a lot of overlap between vulnerabilities in terms of participation with the system and gender. And so taking that into consideration can really help to design subsidies that are more effective. And then finally, in terms of the targeting that I just talked about, one of the things that came up as well that was mentioned by some of the respondents, or it was in the literature, is that this over-targeting sometimes of policy subsidies, particularly if there's many different types of different subsidies at the same time, in countries, again, like Argentina, which have many different types of subsidy policies, can lead to systems that are fragmented, with many different levels of benefits for different population groups, where it's hard to understand what one is eligible for or not. So one has to be also careful to the extent that subsidies are used and how coordinated that is. There's so much more that I would want to tell you, but to wrap that up, I want you to think again about the very first categories that I showed you, which were the price-based, the design-based, and the perception-shifting instruments, to highlight the fact that there is a lot of potential in subsidy policies to reach many different types of policy goals, like we saw, depending on what country context we have. But in none of these countries were subsidies used exclusively to achieve those full goals. They were always part of a menu of different policy options, and potentially, we don't know for sure because of the literature gaps, potentially a lot more effective when combined and used together. So that's it for me. I think I took a little bit more of my time, so apologies for that. And we go to the next presentation. Oscar and Aliela, please go ahead.
Hola, ¿qué tal? Buenas tardes, buenos días.
Hi, good afternoon, good morning, depending on where you are. I'm here to present the work done together with Oscar Cetrangolo. We would like to thank Chantal, she, and Fernando, because we were in touch and discussed with them to work on this document that was able to collect information and experiences about subsidized social security contributions in different parts of the world. And this offers quite a new tool to analyze the subsidies. And in the case of countries willing to make headway in this direction, they can assess the different design options of subsidies. So it's an interesting piece of work. My presentation will be structured as you can see on the slides. I will first make an introduction to the report that we did together with Oscar. Then we will briefly go through this new approach that we adopted to draft the report, which is a modular approach, allowing you to tell apart the characteristics of different subsidies according to different dimensions or modules. Next, we will briefly present 7 cases that are analyzed in the document, and we will draw some conclusions and share some final remarks with all of you. Moving on. By way of introduction, the goal of this report was to highlight something that was not analyzed in detail in the past, and compare the different subsidy schemes that exist globally. So we wanted to analyze information regarding the objectives, the impact of these policy objectives, to assess the design of such subsidies. So the document aims to find common denominators and differences in the analyzed cases, so that other countries who want to take this path can use it. So it's important to underscore that schemes vary dramatically depending on the country, on the context where they are implemented. So it's very important to bear in mind, for example, the macro circumstances are very important, because one scheme can work in a place but not in a different country. For example, the labor market operation, the informal work levels, institutional capacities of governments to implement these policies, and also the social protection system in place. We have countries with broader social protection systems in place. So maybe a specific or a targeted subsidy is not so appealing as in other cases in which the social protection is not so broad. Okay, next slide, please. So we conducted an analysis based on a modular approach. The approach includes 5 main components that characterize these subsidies and social contributions. The first dimension is the policy motivation, which is basically the primary objectives. The policy has to include a series of primary objectives. Maybe they want to focus on employment formalization, or maybe bridging coverage gaps. And if there are secondary objectives, very often not all objectives follow the same direction. There are trade-offs regarding the components of a specific policy. Number 2 is the subsidy design, whether the subsidy is designed as a fixed amount or a percentage reduction of social security contributions, or a blended type, a combination of both, whether there's progressiveness included. So it's important to take into account the amount, the dimension of the subsidy, whether it's relevant or not, and if the subsidy is integrated with the general tax system, the social security of the country, or whether this is an isolated scheme. The third dimension has to do with the duration of the subsidy. In this case, there are 2 main options. Number 1, for the subsidy to be temporary, so time-bound, and after that period of time, it's not in place anymore, or it can be a permanent subsidy. So it's for the long term. There are different cases that illustrate these options. As for the financing, as Bettina said, there are different options. The explicit funding that is done through the government budget, and then we have the implicit funding through cross subsidies from formal employees to specific target groups of the population. And another alternative could be private funding or external funding. You will see that there are several cases that will show that practice. And the last dimension has to do with the targeting. So who are the target group of the subsidies? So the targeting can be, or the target group can be, I don't know, self-employed workers. They can target specific professions, construction workers, agricultural workers. And in some cases, they target specific regions. There are cases of countries that target the least developed regions of the country. But generally speaking, schemes target vulnerable groups, women, the youth, and informal workers. In practice, what we see is that subsidies include a combination of these characteristics, which results in a matrix of different choices to design subsidies. So the cases, I will briefly mention each of the cases, trying to focus on the most relevant aspects, the main highlights and challenges of each case. For example, we have the simplest and CMA case, which are simplified schemes in Brazil. Then we have the Estidama++ in Jordan, that was mentioned by Chantal. We have the ISSA in Malaysia, the Philippines Contribution Subsidy Provider Program, the Tunisia regime for the self-employed workers, and then the 5-point subsidy and the 6-point subsidy in Turkey, and the monotributo in Uruguay. Very briefly, let me highlight some aspects about these 7 cases that we analyzed. In the case of Brazil, Simples belongs to a broader tax reform that wanted to formalize small businesses, and they wanted to simplify the multiple taxes paid by companies. It's a permanent scheme, and it unifies in one single payment different taxes and contributions from 3 levels of government. This is a very important element because Brazil is a federal country, and this entails an institutional coordination by the 3 levels of governments. It is implicitly funded, so the lowest contributions are funded through cross subsidies by other workers. And in this case, a big challenge has to do with this long-term sustainability of the scheme because of the implicit funding, and because it de-incentivizes business growth. Because generally speaking, companies tend to underreport their income because they don't want to pay more if they are subject to the general tax regime or scheme. Next one. Here we have the Estidama++. Chantal mentioned a couple of things about it. It's a contribution subsidy that is explicitly funded by external donors and for a specific period of time, a year specifically. This targets vulnerable workers, and it works with a financial subsidy both for employees and for employers. A highlight about this scheme is that once the subsidy finishes, over 95% of those who benefited from it kept paying the full contribution to the social security, which meant a successful and sustainable transition of the scheme to a full contribution. Nevertheless, a challenge identified is the dependence on external donors, because that is not necessarily sustainable in the long run, and the Jordan's government is assessing that possibility. In the next case, this is Malaysia. In Malaysia, we have the ISSA, which is a contribution subsidy that aims to incentivize the voluntary participation in social insurance. How? Well, through a 15% government matching contribution. So the government contributes with 15% of savings, voluntary savings, for the pensions of those workers that voluntarily sign up with the scheme. This scheme is explicitly funded. It's temporary. Initially, it had a very low coverage. Many of the workers regarded the voluntary contribution as, well, it was not an incentive enough for workers to sign up. But a novelty here, a new component, was the following. The government included Grab and GoGet, different platforms, to sign up with the scheme and to promote and encourage the voluntary contribution of different workers. Next case, the Philippines. The Philippines is quite a novelty because it's the only approach that includes private funding of contributions. In this case, there are no direct tax costs, but the private sector sponsors and makes social contributions for a specific group of workers, the one they decide to sponsor, for 6 months. So it's temporary in nature, but it's quite a novelty. It's an interesting case. I mean, it's a high dependence on the private sector participation, which constrains the scheme and the scheme's sustainability in the long run, and the possibility to scale it up without adding a public incentive by the state for the private sector to sponsor the social contributions of the most vulnerable workers. Then we have the case of Tunisia. In Tunisia, self-employed workers have a scheme, which is the RTNS scheme, which is an implicit subsidy offering a lower rate applied to a fixed income category system. In this case, this implicit funding is funded through cross subsidies with general scheme workers. And as it happens in many implicit funding cases, is quite limiting in nature regarding the long-term sustainability, because the rates are much lower than the income generation potential of the workers. Then we have Turkey's case. Turkey has different subsidies for social contributions to try and increase formality, reduce informality, and reducing regional economic disparities. I'll discuss the 6-point subsidy, which are 6-point reductions to the social security contributions. It's a subsidy that is time-bound, depending on the region in which the worker is located. It's a subsidy for employers, and they can enjoy a 6 percentage point reduction of their social security contributions. And it's also funded explicitly by the state. The challenge in this case is to assess, since this is a temporary scheme, well, it's to assess whether companies retain the workers once the subsidy is over. And in the case of Turkey, there's a diversity of social contribution subsidies, which may mean a negative incentive for companies because they include in their financial planning the existence of such subsidies, and it generates dependence on state subsidies. And finally, we have the case of Uruguay. Uruguay adopted in 2001 a monotax scheme. It's a simplified contribution scheme and tax scheme for SMEs and self-employed workers that aims to facilitate the payment by fixing a fixed amount to facilitate tax payments and contribution payments. This is a permanent scheme. It is implicitly funded through a cross subsidy of the rest of national workers. And in the case of Uruguay, it really managed and achieved to get the participation of self-employed workers into the formal labor market, but it focused on the adequacy of social protection benefits, because in some cases these are specific benefits compared to the broader social protection that exists in Uruguay. And another challenge, very similar to the case of Brazil, is the very rushed or abrupt transition to other regimes, to other schemes, because it disincentivizes companies or self-employed workers because they prefer to be subject to the monotax scheme. So these results in what we call tax dwarfism, and companies prefer to stay smaller so that they don't have to pay more. The case of Uruguay is very unusual in Latin America because Uruguay has stable macroeconomic conditions, very low informality, which has favored the success, well, the relative success of this scheme compared to other similar monotax schemes like Argentina.
So to conclude, the success of these tools of contribution subsidies depend particularly on the way in which these tools are designed, these schemes are designed. The modular approach which we presented provides a valuable guide for policymakers to implement across different countries, but we need to highlight key elements. The first refers to sustainability. So the schemes require clear financing mechanisms. Another aspect to be highlighted, another challenge, is to avoid perverse incentives, because the simplified regimes such as the one of Uruguay and Brazil discourage business growth. So companies or self-employed workers would rather adhere to these schemes instead of growing. The next point is to ensure retention of workers, especially when we're dealing with temporary subsidies, as is the case of Jordan, Turkey, and the Philippines. Well, we need to make sure that once the subsidy is over, that the workers will still be formally employed. And then last, we need to take into account the inclusion and the financial, balancing inclusion and financial sustainability. So thank you very much for your attention.
Ariela. Thanks to Oscar and Bettina as well for these insights. We are running a bit behind schedule, but I hope you'll agree with me that it's been worth it to get some of these kind of first understandings, we think, about this emerging literature, both from Bettina's perspective, the practical usage, the way that countries themselves are understanding these tools, but also relating that to the literature, and then offering up this modular approach that I think is really helpful to comparing different features and design features across different schemes and understanding some of their trade-offs. So we're going to move now to the round table. You've already been introduced, so I don't want to take up time, but we are extremely happy to have with us today 4 ISSA members from 3 institutions. Marcelo has already introduced you to offer some reflections on the national experiences with subsidy schemes in your countries. We've got Jordan, Mr. Mohamed Kres. We've got Mexico, Mr. Eduardo Alcaraz, and from Malaysia, we have 2 members from Perkeso, Auni, and we've got from EPF, TC, who is on the line. So we're going to start off a first round of questions focused primarily on the policy objectives, design features, and if possible, the results of the schemes. A reminder to the panelists to take your 5 minutes each for these questions so that we have time for hopefully another round and some Q&A. So the first question to you, Mohamed, is about Jordan's scheme. So the SSC in Jordan, we heard already a little bit about from the speakers this morning, the Estidama++ scheme. You've been implementing this package of incentives to encourage voluntary registration of vulnerable workers. In particular, you've got a special emphasis on registration among women and refugee workers in the scheme. I wondered if you could tell us a bit more about the program and the journey so far from your perspective. What were the SSC's ambitions with respect to this program, and what were the factors that informed the design of the scheme? Especially this focus on particular groups. Over to you, Mohamed.
Thank you very much, Shia, and many thanks for the colleagues from the ILO and ISSA for having me today to talk about my country and the SSC about this remarkable program, which is DAM++. Before I start, good morning, good afternoon, and good evening to everyone according to your time zone. And again, many thanks for having me and giving me the opportunity to represent my country and the SSC in this distinguished event. But first of all, it's worth mentioning that SSC law, it's not discriminating in coverage based on nationality. So migrant workers and foreigners theoretically should not face any problems to be covered by social insurances delivered by SSC. Why I'm saying that? Because, Estidama++, part of the design of Estidama++, designed to target immigrant workers and refugees and foreigners. So if they work formally and have the work permits, then they have automatically can be registered under the SSC. Also, Jordan ratified Convention 102 on minimum standards for Social Security and Convention 118 on equality of treatment on Social Security. And those both important conventions, of course, representing Social Security standards by the ILO. Before talking about, the primary policy objectives and, the design, the results and the ambition about, Estidama++ program, quickly on the challenges that facing SSC in extending coverage, we have high unemployment rate and widespread of informality, unstable low wages, high cost of contributions, employers reluctant to increase cost of labor and formalization, low awareness of social protection concepts, benefits, limited fiscal space to full cover informal workers, SSC limited experience with low-waged informal workers, refugee reluctant to engage with Jordanian Social Security, and lack of trust in Jordanian social insurance system, and gender-based barriers to participation in social protection. So in Jordan and under the National Social Protection Strategy, we have an overall development objective, which is national social protection system achieve substantial coverage of male and female Jordanian and non-Jordanian vulnerable workers, which is very important. Therefore, and responding to these challenges, SSC has launched in coordination with technical support by the ILO SIDAM++ program, with a generous support by UK, Norway, and Netherlands governments, and in collaboration with the UNHCR and from our colleagues at MOPIC and MOAL. So this is to participate in the efforts of extending coverage and formalization in Jordan, with an objective to strengthen the situation of vulnerable workers in Jordan through the extension of workers' social protection rights, access to income support and contribution subsidies, and registration in the social security system. Actually, the design of the program designed to provide contribution subsidies and coverage rewards to targeted groups, including refugees and women, for both wage workers and self-employed. Number of beneficiaries reached almost 47 Ks, with the total benefits dispersed around 17 million Jordanian dinars. The support mechanism includes providing 30 Jordanian dinars as a monthly contribution subsidy and a quarterly coverage reward with an amount 100 GODs, and the total time or the period of the benefits, it's 12 months. SIDAM++ includes covering agriculture workers and agriculture holdings and without limits on number of workers within these holdings. SIDAM++ considered a success story. I can tell you why, because it supported SIDAM++ participated in allowing 243 persons to get unemployment benefits, 408 women to get maternity benefits, 432 persons to get work injury benefits, and 4 persons to get their pensions. So, of course, we faced many challenges like any other program. So, the results, of course, we exceeded, the target. We promised the community and the donors and our colleagues at the ILO to reach 34 Ks, but we now delivered 47 Ks of beneficiaries. Actually, our ambition through this program is to have a permanent contribution subsidy within SSC law. But again, we have piloted so far a very important dimension of extending coverage to vulnerable groups through this mechanism. I'm very sorry for taking this long time, but I wanted to shed the light quickly on SIDAM++ program. Over to you, Shia.
Thank you so much. I think I won't offer any comments, but it was obviously we've heard about the SIDAM++ program, and I think listeners have been jotting down notes and can come back to you with questions in the Q&A. So please, all of the panelists, feel free to answer questions in the Q&A that are directed to you. We're going to turn to Mexico now. Mexico has taken a different approach than SIDAM++. They've taken a sectoral approach to financial support for contributions. So the scheme in Mexico has been in place since 1997. It comprises an annual subsidy to reduce the contributions for sugarcane producers, and it's based on the size of turnover or revenue. So in Mexico, we've got with us Eduardo Alcaraz. What can you tell us about the scheme and how it came about? Why the focus on this particular sector? How did that dialogue start? I know it was a long time ago now, but perhaps you can offer reflections. And then have there been any discussions to perhaps apply the learnings or expand to other sectors? Eduardo.
Muchas gracias, Shia. Un saludo a todos los panelistas. Un gusto poder platicar con ustedes cómo funciona el convenio de aseguramiento para el pago de cuotas de los productores de caña de azúcar. Efectivamente, este convenio este aseguramiento tiene muchos años, alrededor de 28 años, inició en 1997. Sin embargo, el origen data desde 1963. En 1963, la ley del Seguro Social en ese entonces marcaba que los productores de caña de azúcar tendrían que ser parte del régimen obligatorio. ¿Por qué esto? Porque la caña de azúcar es uno de los 10 productos más consumidos en México. Se producen 22 entidades y bueno, es una de los productos de la canasta básica. Entonces, por eso tiene, digamos, esa relevancia e incluso es el único producto que tiene una ley propia de desarrollo, ¿no? Entonces, cuando cambia la ley del Seguro Social en 1997 y este esquema en el que estaban estos productores pasan a un esquema, digamos, de carácter obligatorio, pero con un régimen especial, se necesitan firmar convenios de aseguramiento con las unidades, con las uniones o asociaciones de productores, para que estos manifestaran su intención de seguir recibiendo esta cobertura. En ese sentido, las asociaciones se acercaron al instituto para firmar estos convenios y de manera paralela se acercaron al gobierno federal para pelear el importe que iba a ser destinado del presupuesto de egresos de la federación, es decir, el ingreso con el que se subsidian las cuotas proviene del presupuesto federal. Y desde 1998 a la fecha, el último se acaba de renovar hace un mes, todos los años se firma este convenio con las uniones y asociaciones. Hoy se firma, o la última ocasión se firmó con 4 uniones que a su vez se desdoblan en 137 asociaciones en las 22 entidades del país en las cuales se produce caña de azúcar. Un punto importante del esquema es que cada año cuando viene la renovación del convenio con las uniones, hay una discusión sobre qué clausulados modificar para que permitan una mejor implementación. Por ejemplo, en el último año se hicieron 4 adecuaciones importantes, que es tener, en caso de que de que el subsidio se acabe, ¿no? Este monto del subsidio se acabe y ya no alcance para todos los productores, estos productores que pagaron una parte proporcional, el aseguramiento dure lo que pagaron, ¿no? Es decir, antes, si no alcanzaron el subsidio, no tenían el aseguramiento a menos que pagaran la cuota total. Hoy, si pagan una parte, pueden tener un aseguramiento parcial. Otro de los cambios principales que se hicieron fue el tema de la fiscalización, ¿no? Una de las inquietudes que tenían algunas uniones es que decían que algunos productores muy grandes del país se beneficiaban del subsidio cuando ellos en realidad no necesitaban el subsidio porque pues son productores grandes. Entonces hoy hay una cláusula específica para fiscalización para ver que las personas que ingresan o los productores que ingresan sí sean productores de caña pequeños. Y el tercero, una parte muy importante es la transparencia. Hoy el padrón de los beneficiarios de las uniones se hace público una vez que termina el ciclo agrícola y se tiene digamos, el universo total de las uniones beneficiadas con este subsidio, se hace público este padrón. Aquí es importante destacar que los beneficiarios, los trabajadores de la caña de azúcar, tienen la cobertura integral de los 4 ramos de seguro de la ley del Seguro Social, ¿no? Enfermedad y maternidad, riesgos de trabajo, invalidez y vida y el retiro. Y el aseguramiento es tanto para el trabajador de la caña de azúcar como para sus beneficiarios legales. Hoy, para que se den una idea, más o menos el subsidio, el monto asignado del presupuesto total es de $17 millones. Es el subsidio que se implementará en este ciclo agrícola que inicia el 1 de julio del 2025 y termina el 30 de junio del 2026. Y el beneficio que tienen los productores es alrededor del 50% de la cuota. Es decir, un productor de caña de azúcar tiene que pagar alrededor de 22,000 pesos mexicanos por el aseguramiento anual y con el subsidio pagan alrededor de 10,000 pesos. Lo que hemos visto es que pues hay un incremento en las personas aseguradas y el beneficio principal donde hemos visto uno de los mayores beneficios es en el incremento del salario con el cual son registrados las personas. Para que se den una idea, en los últimos 5 años este salario con el que están registradas las personas prácticamente se duplicó. Hoy es alrededor de 430 pesos mexicanos, que es más de 2 veces el salario mínimo del país. Y esto es más o menos cómo funciona el esquema de aseguramiento en nuestro país. Y la parte muy importante es la firma de los convenios anuales con las uniones locales y posteriormente una capacitación entre regiones del país para promocionar este esquema de aseguramiento en los 22 entidades donde hoy se produce caña de azúcar. Muchas gracias.
Thank you so much. I think everyone's hearing different things because they're all going to be focused on different aspects that are interesting to them. But what I heard, and also what I saw in the slides that you provided, which we can make public on the webinar page afterwards, was also that there's this aspect not just of increasing coverage, but of maintaining coverage. And I think that's an interesting nuance that also came out in some of the points that Bettina mentioned, that there's sort of this counterfactual element. We don't know what the situation would be if the subsidies were not there, especially in these schemes that have been in place for a long time. And also, you touched on the issue of balancing political interests, which I hope we have time to come back to, the importance of maintaining public support around these schemes and social dialogue, of course. So we're going to shift gears now to Malaysia and travel to the other side of the earth. Thanks for staying with us. It's very late over there, TC and Auni. In Malaysia, we're fortunate, as I said, to have representatives from the two main national organizations, Perkeso and EPF. In both cases, we have contribution subsidy schemes that target self-employed workers and housewives. So the housewives is a unique group among the profiles that we received, and in Malaysia, I think it's a really interesting case. So I wanted each of you to tell me a bit more about the programs that your organizations run in terms of their emergence. Some are newer than others, but also their motivation and the design considerations. So let's start with Auni, and then Auni, we can hand over to TC after.
All right. Thank you, Shell and ILO for inviting Perkeso to speak in this session. So before I answer the question, I think for context, Perkeso is an agency under the Ministry of Human Resources, and we administer social protection under 4 laws. So 2 of the laws, which are the Self-Employment Social Security Scheme and Housewife Social Security Scheme, were intended to close the coverage gap in informal workers and unpaid care workers. As we all know, these two main groups are often left out from the formal coverage system. And when we're talking about motivation and design, right, I think I would like to share or take you on our journey when we first started our self-employment social security scheme in 2017. So when we first started, we initially make it mandatory for the passengers transportation sector, which includes taxi drivers and e-hailing drivers. But despite making it mandatory, the uptake was very low. So in the beginning, it made us learn that making something mandatory does not guarantee participation. So especially when the target group is less aware about social protection, and then they see little immediate value out of the program, or perhaps struggle with making contribution payment when incomes are regular. So fast forward to 2020 when the COVID-19 pandemic hits, and then we saw a large coverage gap in self-employment, especially among gig platform workers and informal frontliners, which were critical during the crisis, and which they were largely unprotected. So in response to this, the government of Malaysia introduced contribution subsidies, which subsidize 70% of the scheme's contribution to make the protection more affordable and accessible to this critical group. And it was later being extended to 19 other sectors under the scheme. So every year, the government allocates around 23.5 million US dollars under the national budget for this contribution subsidies.
So while the contribution percentage may varies from 70 to 90%, depending on the sectorial priorities, and in some cases 100% for volunteers under the public sector, the intention remains the same, which is to lower the cost of barrier and make and to promote soft landing into social protection for sectors that we plan to make mandatory and also high risk sector. So currently we've add additional 2 more sectors for mandatory coverage, which are the food and good delivery sector and hawker sector. So identifying and also reaching out to informal workers were very challenging at first, primarily because we never had a centralized registry of self-employed to begin with. So the government contribution subsidy really helps the PERCESO to support in terms of building that awareness and also trust towards the protection scheme. And apart from that, I think we were successful in terms of public-private collaboration. PERCESO appoints a corporate agent among government agencies, platform workers, and unionized association of self-employed to help us with registration and contribution collection in bulk. And we've also seen CSR programs as well as elected representatives such as members of parliament and state assemblymen stepping in to sponsor contributions for their constituents. So this eventually improved the access of social protection at the very grassroots level. So overall, the result has been very significant. From only 7,200 registrants in 2017, the coverage scheme had grew up to 884,000 by 2024. And we've seen a major spike in 2021 when the contribution subsidy was first introduced. So to sum it all, I think from PERCESO's experience, we offer like 2 key takeaways, which is one, the contribution subsidies work, especially when it's combined with trusted intermediaries and local engagement. And then second, targeting high-risk sector first with phase mandatory is much more practical than trying to enforce all sector at once. Thank you.
Thank you. TC, we're going to pass straight to you for the sake of
All right.
time.
Yeah. So good morning, good afternoon, and good evening, depending on where you are. So, and thank you, ISSA and ILO, for having me. So I'm TC from the Employees Provident Fund of Malaysia. So basically, just to quickly set a bit of context, while PERCESO look at the 4X, EPF Malaysia is actually a DC scheme, and our mandate is to ensure the retirement income security of Malaysians. I'm more than happy to share some of our efforts in utilizing subsidized contribution to expand retirement protection, especially to the self-employed individuals and those outside the labor force, especially the housewives, which are groups that traditionally had limited access to formal retirement income security in terms of legal framework, which is mainly the motivation behind the programs. So under the EPF, we have 2 incentive-based voluntary contribution, which are first ISSA, and this was actually presented by the ILO expert just now, and ISURI, which is designed specifically for housewives registered under the National Poverty Database, and it aims to recognize the contributions of them in care work and also to offer them the access to a more structured kind of retirement savings. So for both programs, our design consideration actually focuses more on simplicity, affordability, flexibility, and also using incentives to nudge positive savings behaviors. So members can actually contribute any amount at any time using our mobile app, or they can just visit our branch, and they actually enjoy the same benefits as other formal sector contributors, including the dividend earnings and also access to all types of EPF services. So maybe I will focus a bit more on ISSA as it was presented just now. I would also like to take this opportunity to share some recent updates to the program. So ISSA has the government incentive for ISSA has actually increased from the 15% to 20%, and the current cap annual cappings has also been increased from 300 per year to 500 ringgit per year, which is about 105 USD. And in addition, the incentive structure has also transitioned from a time-bound feature to a more permanent one, with a lifetime cap of 5,000 ringgit, which is about 1,000 USD for each participant. So the reason for doing this lifetime cap is actually to encourage long-term contributions habit, and also at the same time manage the government fiscal space as well. So with the increase of incentives, we can actually see an increase of take-up. So just by comparing this year and the previous year, the ISSA participants actively contributing has actually increased about 38% compared to last year. But of course, I think most of the challenges we face has already been highlighted in the ILO report. Basically, it's the sustaining regular contributions, because we noticed that many of our members contribute either only once or just enough to qualify for the maximum government incentive. And also another challenge is also in terms of take-up. Although the increase has been quite significant, but it managed to get about 15% of our total self-employed informal workers in Malaysia. So to address this, we are exploring a few methods. For example, using behavioral nudges, a more flexible auto-debit mechanism. And additionally, we are also exploring the idea of working closely with platform providers, regulators, local councils, and also associations to actually auto-register their members under their wing into the EPF, and also implement an auto-contribution mechanism with a voluntary opt-out option. So basically, we are putting them in default. Once they are in the scheme, they are required to auto-contribution, deducted directly from their income at a rate of their choosing, and they can actually opt out if needed. So I think that's all for my, Thank you.
Thank you. Thank you so much. And I think we could listen all day, and people are definitely going to be following up with both of you. Just some things that I highlighted really quickly. I think this is, Auni, you went to a crucial question, policy question of voluntary versus mandatory in these schemes. And it's really interesting to see how that question has been so thoughtfully considered in Malaysia, in both of the cases that were described. And then I also heard how important, both of you underlined this in different ways, the policy matters, of course, but that can't be separated from the administrative capacities and administrative considerations, and how those are also being, taken on board really thoughtfully in the Malaysian case. And then finally, this idea of the housewife scheme. So you spoke to the motivations. Was part of that was recognizing care. So very interesting example, and I'm going to hand over now to Chantal to take us through the rest of the program. Chantal.
Thank you, Shane. So on to round two. We'll make this a bit of a shorter round given our time constraint. But the idea here is to do a bit more of a deep dive. So each of the schemes is very unique and super interesting features coming out. So we'll do a bit more of a deep dive into each of the design features of the different schemes. So first, returning to Mexico and Eduardo. So one unique feature of the scheme in Mexico is the grounding in this tripartite framework. And you talked about the unions and the associations and the important role that they play. Can you expand specifically on the role of the national cane growers unions in facilitating this producer registration? How are the agreements with the Social Security Institution, IMSS, determined? You touched on this a little bit already. And how has working with the partners supported registration? And have these partnerships played a role in shaping contributors' perceptions of the scheme? Over to you, Eduardo.
Gracias, con gusto, Chantal.
Sure. In Mexico, we have a tripartite social security. 70% is contributed by the employer, 20% by the employee, and 10% by the government. So with these sugar producer associations, we have a key partnership because most of the contribution is paid by them. So these agreements that we signed in 1998, since that year, include a clause by virtue of which producers will pay the annual contribution of sugarcane workers in exchange for a subsidy. And the subsidy is approximately 50% and is paid by the federal government. And every year, the federal government at the chamber of MPs, we fight for that subsidy to exist, to be maintained, and it amounts to 300 million of Mexican pesos, approximately. So all the unions with which we signed the agreements, at the beginning, we signed them with 2 big national unions. And in the last renewal of the agreements, we signed with 4 different unions that grouped together 137 associations. And the 137 associations are scattered throughout the country in sugar-producing regions. So the institution, instead of signing 137 agreements, we signed the agreement with the union that is the umbrella organization of these smaller associations, so that we have a more direct connection with the union, and the union disseminates the information throughout the country. And the most important part is that every year when we approach the renewal of the agreement, it's in July, because it goes from July to July next year. So around April every year, we kick off a negotiation regarding the clauses that need to be adjusted or updated in the agreement to have more clarity as to the implementation of the agreement. For example, the coverage, to aim for an increase of formality, an increase of the basic salary, etc. And to have transparency and to check that the subsidy is really being implemented to smaller producers, which is the target group. That's the way we work. Thank you.
Fantastic. Thank you. Really important insights into a sector that I think across the world, even in high-income economies, is very challenging to achieve full coverage for agricultural workers by nature of the casual or seasonal nature of the work, but then also, of course, amongst the associations, such fragmentation. And so it's really interesting to see this more innovative approach of working and capacitating, having the agreements directly with the tripartite bodies further up the value chain, if you like. So fascinating example there. Let's move quickly on. So next question to Malaysia. So in Malaysia, so we've heard, thank you very much, from EPF and Professor about the multiple different schemes covering self-employed and housewives. And the interesting part here is that when you've targeted and tailored these subsidy programs across a wide range of workers in vulnerable situations, it also introduces this consideration of needing careful coordination. So thinking from the beneficiary perspective, what mechanisms do you have in place to ensure that workers are aware of all the potential rights and their obligations and the benefits available to them under the different subsidy schemes without creating confusion? And again, sorry, but I need to keep you ideally to 2 minutes each, please. Maybe we can start with TC.
Maybe just a quick one. So basically in Malaysia, we have a wide range of targeted subsidy scheme, and I understand that it can be sometimes overwhelming. So many are unsure of what they are entitled to, how to apply, and how to continue actually contributing consistently. So from the EPS perspective, we actually put in several mechanisms, but starting by having some data integration. Like for example, for the housewife program, we actually leverage on the National Poverty Database to identify eligible housewives and auto-register them into the scheme so that it can remove the burden of self-registration. And I think this is quite common. We use digital access and tools, basically increase the accessibility to our mobile app and website. But for those who are in the rural area, which digital access can be quite limited, we actually work with government agencies, local councils, and community leaders to organize roadshows and community briefings. And one interesting thing is that we actually run an internal innovation campaign across all EPF branches, sort of like challenging them how to come up with new ways to ensure the awareness level is high among the eligible participants. So one standout idea actually came that that branch actually partnered with a recycling company. So together, they actually organized a community recycling campaign where Malaysians sell recyclable items and the proceeds will be credited directly into their EPF accounts under the ISSA program. So it's actually a small but very powerful initiative linking sustainability, linking retirement savings, linking about making the act of saving more tangible, inclusive, and community-driven. So efforts like this show that actually beyond policies and platforms, local creativity can sometimes help, and it can also play a big role in helping people taking the first step towards the programs. Yeah, I think that's all from me.
Thank you, TC. And over to Ani.
Okay, so from Pekeso, I think we've seen success in our platform-led initiative, especially when we work together with big platform companies like Grab and Foodpanda. And they've helped us in terms of sharing information about the scheme and contribution subsidies across their channel. And we've also seen certain platform even take the initiative to provide prompt messaging into their apps to set regular updates about registration deadline and also subsidy top-ups on behalf of us. And then second, I think we've mentioned again about the corporate agent. So this corporate agent really, as I mentioned before, they help us with bulk registration and bulk contribution collection. So these they are like they act as a local touch point for us, and especially when we are trying to target informal workers at the rural areas. And third, I think we've conducted a multi-channel promotional campaign across the country, and this includes normal digital promotion across radio and television as well as social media. And we make sure that this promotional campaign always coincide with the federal budget announcement to make sure that the initiatives are timely and policy aligned. And we also leverage on real life cases that draw the wide attention from the public to promote social protection. So in the case in Malaysia, we had the MENA air crash accident, where one of the victim is a platform gig workers covered under Pekeso, and it draw a wide media coverage. So it helped the public intentionally, it helped the public to understand better the tangible benefit of our scheme, especially on survivors' compensation to the family. So overall, this moment became a turning point for behavioral changes where more riders started to register and take up the contribution subsidies by the government.
Thank you so much. Some really interesting cases specific to each sector, and then leveraging local partnerships, as you say, or in the example of platforms, the platforms themselves to disperse that information to workers. Thank you so much. So over to the last question for Jordan and Mohammed Kharis. So in Jordan, we know that the Estidama Plus program in its current form was time limited. What can you tell us about the lessons from the experience so far, and any plans that the government and ISSA have to apply the lessons in future policies and programming?
Thank you very much again, Chantal. Of course, we have faced, many challenges. We have changed them into lessons learned. For example, the communications, as the majority of targeted population under Estidama++ were never approached by SSC, like migrant workers, Syrian refugees, and agricultural workers and agricultural holdings. The other challenge, weak role of partners and stakeholders at the beginning, including civil society organizations, registration on digital platforms. This is new for the targeted groups. as target population suffered from digital and financial illiteracy, and a clear grievance mechanism for them, how to protest and how to reapply and etc. But the lessons learned again from SIDAM++, we have changed the majority or all the challenges that we have faced so far into an opportunities, and we reflected them into new opportunities, and we tried many ways to deal with the challenges. So just to quickly go on them, raising the awareness by using new innovative tools, like for example chatbot, SMSs, and to do the face-to-face consultation sessions into the targeted groups, introducing a mechanism to lower contributions for old age, disability, and death for employers, introducing a contribution tranches system to allow self-employed to contribute, also draft instructions to cover workers in a flexible working environment, developed an occupational and health safety strategy to prevent and reduce work-related accidents and injuries, conducting a study on social insurance options for workers in formal economy in coordination with ILO and World Bank, gradual inclusion of agriculture workers in agriculture holdings and social insurance provided by ISSA based on a cabinet decision. And then the first phase involved, of course, including agriculture workers in work-related injury and maternity insurance, also conducting and updating a study in coordination with ILO on how to cover workers in digital platforms. So again, reform the current unemployment insurance, which working currently through the savings accounts mechanism into a full risk pooling mechanism. The latest update on the National Social Protection Strategy, it mentioned a complete output about informality and how to deal with informality and how to extend coverage into informality. So the SIDAM++ as a pilot informed the National Social Protection Strategy, and also informed us through a comprehension or a comprehensive vision for the SSC through a wide discussion paper about the future of the SSC, about to do the balance between the short-term benefits and the long-term benefits, and how to motivate and attract people to be covered under the Social Security umbrella. So SIDAM++, honestly speaking to the audience, it allowed us to have many lessons learned. It's changed, the way that we are looking at the Social Security and social insurances. Again, many thanks for all of you to having me today, and over to you, Chantal.
Thank you so much, Mohammed, and great to hear that the contribution subsidy has not only been successful, but is also informing broader strategic thinking within the Social Security Corporation, but also in the wider national strategy. And I'm also remembering fondly on the targeting and the outreach to workers that were not typically targets for Social Security, particularly refugees, and SSC sort of conducting awareness sessions for the first time in camps and getting participation that way. Let me stop there in the interest of time and pass back to Shay.
Just 30 seconds really to say thank you to everyone joining us from all around the world, participants, listeners, but also researchers for helping build this lexicon and this way of understanding contribution subsidies. We know that there's a lot of activity both at the policy but also the administrative level, and I think that was really illustrated through the cases that were presented both in the ILO study but also here on the National Roundtable. And we hope to continue to follow this with all of you. It's been exploratory so far, but also the aim was to make it practical and accessible and not too economistic. So I hope that we've achieved that at least as a starting point, so that moving forward, it could be helpful for all of you as you're thinking about your systems. So we invite you to continue to share your perspectives, but also experiences that we've missed or that you didn't have a chance to tell us about yet. And I'm going to hand back now to Fernando to officially close the webinar. Fernando.
Thank you so much. I promise I will not take you long. It's still 130 participants, so it must be interesting. Thank you so much for everyone to staying so long. I guess I want to reflect on a couple of things. The first one is just we as practitioners and policymakers and researchers should avoid the trap of trying to make complex problems into simple solutions, right? Complex problems and complex situations require complex and heavy solutions, right? So to answer it or to achieve increase coverage, to decrease informality, none of that is going to come through, one tool, one policy objective, one easy thing to do. I mean, whoever tells you that is lying, and is selling you something that you should just run away, right? So I think what we heard today is, look, there's a very complicated situation, and there's so many dynamics and variables that we have to account for, no? And this particular tool, contribution subsidy, does work. However, right, it works when blah blah, right? In this context, when we combine it with these other things, etc. We have to consider so many things, like how sustainable it is and fiscally responsible. We have to consider if we are actually reaching the targets and the people that we want to reach. We need to consider if affordability by itself it's the issue that is impeding coverage expansion. But we also have to think, as Mohammed was saying, for example, a broader agenda on adequacy and trying to see if the benefits are the benefits that are relevant for workers, etc. So I guess my reflection on what I take out of this webinar is this is a very complex issue. Contribution subsidies are one way and one policy tool that is relevant, that is tested, that can work in certain circumstances. My invitation is, let's not try to put a square into a circle. It's not that now we go out and we start doing contribution subsidies because they're good and their work. We have to understand in the context and how to complement them. They can be systemically implemented. I know that, and we all know here, subsidies get a bad rep. And as we've seen today, contribution subsidies can be implemented in a systemic way, thinking as a feature of a wider system that is, again, complex and rich, which I very much enjoy and found very interesting and very compelling. Thank you all so very much for your interest in this. Please expect the reports. One report is gonna try to place contribution subsidies within the wider menu of policy options that we have on this. And then the other is going to be a practical guide on how to do contribution subsidies and what to include and what to consider when you're designing yours. So please wait for those. Thank you so much for everyone. And it's been a pleasure. Have a good night, day and morning.
Thank you.
Thank you.
Thank
Bye,
you,
guys.
everyone.
Bye-bye.
Bye-bye.
Thank you.
Bye-bye.
Bye-bye.
Thank you.